Hey guys, how you doing? Dr. Andrew here from Robina Chiro Wellness Centre, and today's topic today for the Chiro Couch is, what does an adjustment to do? Now this is a massive question because I could go all into chiropractic philosophy, I could get into the chemical, the emotional, the physical side of things as well. I'm going to try and break it down into quick chiropractic philosophy, subluxations, what are they and how do we adjust them, for example. What's the noise, what are the side effects from a good point of view, and what are the safety behind it, and of course the alternatives to it. But I just wanted to start with the principles of chiropractic. Now, the nervous system is the most important thing in the entire body. Simon behind us there demonstrates that your nervous system here is surrounded by bone in your skull and your spinal cord in your back. So it's the only part of your nervous system that is surrounded by bone. That's how important it is. Now, would you believe that your nervous system actually starts at around about day 20 of gestation? That's how important it is. It's the first cell to be differentiated. So when we think about what's the most important thing in the body, we all know that the nervous system is the most important part of it. Now, the chiropractic principles and philosophies behind why we do what we do is we want to make sure that your nervous system works really well. And that comes into the conversation about the subluxation. Now, a subluxation is basically when a bone or vertebrae is out of position and it's impacting the nervous system, all right? Now, there are other things that can impact as well. So, for example, it can impact the facet joints and can lead to things like arthritis. If you have a vertebrae tilting to the side, it bulges, and that little bulging there can affect the nervous system, but also it can affect the muscles too, because if a spine is going forward, it'll actually affect the way that your muscles work as well. So we talk about posture quite a bit with what we do. That's why subluxations are so important to correct, because it can actually create lots of health issues, not just pain, for example. And that gets us to what is an adjustment. Now, a lot of people think that adjustment is just cracking a back, and you know what? Anyone can crack a back. It's how you do it and how you actually do it to make you feel better from it, because you can actually have a bad adjustment, and a bad adjustment can actually have negative effects of the body as well. So it's knowing what to do, where to do it, and how to do it safely, which is the art of what we do. The science behind what we do, I've got into that another day. I'm not going to get into the literature behind the effectiveness of chiropractic care, but basically as a result, your nervous system, your muscles, anything that's connected to your nervous system, like your organs, will all be working better as a result of realigning those subluxations. Now, other chiropractors will get into the chemical side of things, so your body starts to work better on a chemical point of view, even emotionally. When your posture starts to improve, have a better posture, you feel better as well. That's another talk for another day, basically. But anyway, you'll hear this little cracking noise when we adjust the spine, and all that is those joints that are really tight together. As we pull them apart, makes a little popping noise. So what it does, it actually opens that segment where that nervous system is, and obviously releases that pressure on that nerve. So once again, as I said before, wherever that nerve goes to will start to work better. Now, the side effects of that is that it's not just your nervous system works better, everything else connects to it is better, but your body will feel better as well. So people say that I instantaneously feel better. Sometimes it's because the muscle relaxes. Sometimes I say because they've got range of motion changes. Or I even have some people say that, when my upper neck is relieved, maybe their balance or their sinuses or their eyesights, headaches, things like that improve with a simple alignment. Now, there are some cases which are a little bit more difficult than others, and there might be some degeneration or arthritis in through those areas there. That's a different story, and it doesn't just take one crack, I suppose, to fix those things. But in terms of safety, we always take x-rays. We always make sure we do the appropriate testing for anyone who might have some red flags, and we don't adjust if we don't know, okay? Now, the alternatives that we can do, there is a device called, an arthrostim. Or we've got an activator. These types of adjustments don't involve a crack. We've got a table which lifts up and drops down as well, so there's lots of different ways of doing it. Lastly, because I know I've been going on for quite some time, is that there's 3 different types of chiropractic care. Now, you can have just a regular adjustment whenever you feel like it. We call that crisis care, and crisis care basically is a patch, okay? Like a Band-Aid, basically. I just need a Panadol, we'll take it there. Now, in a lot of cases, this is not the most effective way to look after your back. It's like going to the dentist, I suppose, when you only have tooth pain. It might be that tooth pain that requires that tooth to be pulled. Now, there is corrective chiropractic care, and that's what we specialize here at Robina Chiropractic Wellness Center. So basically, we make sure that your body gets adjustments before they need it, so your body gradually improves. It's sort of like the difference between going to the gym for maintenance and gym to actually build muscle. Okay, and then the last one is maintenance. So we decide how long it takes for your body to go from one point here to another point here. In other words, we improve it and then it slowly goes back to its old pattern. It could be sleeping habits, it could be knocks, bumps, slips or falls, okay? And then we try and adjust it before it gets to that point of pain. All right. Now, a lot of my patients go through corrective care before they get to maintenance care, but you can also have maintenance care at the level of there. But my philosophy is that if you want to maintain something, let's maintain it at this level. Let's not maintain it at that level. So I hope that helps you there. There's lots of different conditions that chiropractic can treat. I've done lots of talks on that. It's not just about pain. It's actually about looking after your nervous system, not just now, but for the rest of your life as well. So I'm going to stop talking now. If you have any questions, please comment below or send us a message. Or you know what, if you actually have never had chiropractic care and you actually want to try it, or you know somebody who needs it, give them a call, give us a call, or tell them to call us, and we'll get you booked in and we'll make sure that you don't have any of those subluxations, and you might be lucky that you don't, and then we don't treat you if we don't. So my name's Dr. Andrew from Chiro Wellness Center, and I hope you're having a wonderful Friday. Bye for now.